Welcome back from the break. I'm Bella Walser. Over the past decade, ketamine has become a much larger conversation in both negative and positive ways. Ketamine is a dissociative medicine that is used traditionally for anesthesia, but also as a treatment for pain management and mental health. You may have heard of the recreational side of ketamine, or maybe even some scarier perspectives like being used as a horse tranquilizer or ketamine potentially playing a part in Matthew Perry's death. However, there is a whole other side of ketamine being used as a medicine. The drug is not only used as an anesthetic, but also as a tool for mental health. This is known as ketamine-assisted psychotherapy. The number of ketamine clinics has grown exponentially as individuals begin to look for alternate ways to help with their mental health. Ketamine clinics even exist right here in Fort Collins. I had the opportunity to speak with 3 different therapists who work at 3 separate Fort Collins businesses that offer ketamine-assisted therapy.
There's a lot of hype. People are seeing it in every magazine. It's on the news a lot, positively and negatively.
Ketamine-assisted psychotherapy, also known as CAP, is one of the growing ways ketamine can be used beneficially.
So CAP is an intervention using ketamine to induce an altered state for people. There's been some benefits have actually been tracked since the 70s for the usefulness of this, antidepressant effects.
So enter ketamine to be kind of a rapid change agent and really lift you out of that muck sometimes that we get stuck in to do the things that you might otherwise not do, like participate in doing things for yourself that help you out.
The assisted therapy can be useful for many mental health challenges.
I have seen it work for a wide range of things, for people exploring things about their identities and relationships, to working with trauma, symptoms of obsessive compulsive disorder.
So beliefs, rigid thinking patterns, that's places where people can get really trapped and feel kind of hopeless, and they've tried lots of different things and don't really seem to get traction.
But how does ketamine work as an assistant to therapy? Well, ketamine mainly works by having a lot to do with brain plasticity, which is the brain's ability to reorganize and adapt through new connections.
Glutamate is the #1 excitatory neurotransmitter. Glutamate has a receptor that ketamine blocks. Ketamine blocks that, so glutamate doesn't work.
So ketamine works by blocking off these glutamate receptors, which then causes a spike in these key neurotransmitters.
And a couple, 2 or 3 days after, your brain, like I said, very neuroplastic, it puts out dendrites, which are the ends of the nerve cell that make connections to the next part of the nerve cell. And all of a sudden, 10,000 more here and 100,000 more there, and all of a sudden those pathways that you're on forever, making every decision of your life that no matter what it was not very comfortable when you made it. Now you have different ways to kind of approach the same decision.
So by influencing these glutamate levels, ketamine is able to promote brain plasticity and create new connections.
So you're making new connections, making new pathways, which, whether it's depression, anxiety, addiction, suicide, those are built on old pathways and old programming, and this allows you to kind of create new ones.
With the help of ketamine to promote more brain plasticity, therapists then work with their patients to create change.
We really want to be in here and supported with someone that can help navigate the different material that might show up, and in doing that, create a supportive environment to then they can actually make meaningful change outside of the therapy office, which, in my view, is where the majority of the work happens.
The integration is really where the rubber meets the road with this treatment.
The work you do in between the time you do the medicine is what really makes the difference. It's called integration. You integrate those things. What do those experiences mean? How does that make movement in your life?
However, ketamine does have many perspectives and stigmas that can give the medicine a negative view.
I get it, because those stigmas come to folks in a lot of different ways, but maybe at the same time a really honest conversation about how many lives ketamine's changed.
I think people are worried that it's going to be scary. It's not everybody's cup of tea, or they might have fears or misconceptions or things like that, and so I would educate them, just kind of plant the seed. There's no pressure, because it's not something that it's a very different approach, and so it's not something that everyone is going to come ready to do right away.
For potential patients, therapists recommend to do your own research and make sure you find a safe and reliable office.
So if you're looking for this treatment, you're going to want to look for, from my perspective, look for ketamine-assisted psychotherapy. So you're getting the combination of the psychotherapeutic support and the ketamine, not just the ketamine.
And I think that asking therapists what they're trained in, how they've been trained, also that they've got their basic life-saving skills. I think that ketamine-assisted therapy can add another layer that then allows them to feel empowered in their life in useful ways, beyond just kind of coping with stress, but actually getting on with the life that they want to live.
It's important to keep in mind that all the therapists I talk to recognize that there are many risky ketamine clinics out there that are not all as regulated. Because ketamine is legal for medical use, any nurse practitioner or doctor can prescribe ketamine off-label, which makes it very easy to get. I had the chance to speak with the former president of the American Society of Anesthesiologists, Dr. Randall Clark, who has done research on some of the negative impacts of the drug when used as an anesthetic.
So just having a clinic set up someplace to be able to give these therapies, in my opinion, is not a good thing. It really needs to be a comprehensive program with lots of safety measures in place and a fairly rigorous approach to how you take care of patients.
Clark recommends a multidisciplinary approach for ketamine-assisted therapy, which means there should be both a doctor and a therapist to help create a support framework for patients. Clark sees ketamine as a powerful drug that can be extremely beneficial in many situations, but should also not be taken lightly. As of right now, ketamine is the only psychedelic that is nationally legalized for use. However, Colorado is among the few states that have recently made strides in the world of psychedelic medicine. The Natural Medicine Health Act was approved by Colorado voters in November 2022. The proposition decriminalized psilocybin, or more commonly known as psychedelic mushrooms, for people over the age of 21. Coloradoans are still unable to buy psilocybin over the counter, however, it is legal to consume and grow small amounts. Under this proposition, Colorado regulators can also decide to create similar programs for 3 more psychedelic medicines starting in 2026.
It's interesting with it being decriminalized compared to cannabis, which is legalized, which means you can, amongst other things, you can go to a store and buy cannabis. In the Natural Medicine Health Act, there are 4 medicines that were decriminalized, so you can't go to a store and buy DMT or mescaline or ibogaine or psilocybin.
Along with psilocybin, MDMA is another psychedelic medicine making breakthrough. At the end of 2023, an application filed with the FDA approved MDMA to treat post-traumatic stress disorder. If the application is approved, MDMA would be the first psychedelic treatment approved, specifically for mental health.
It's specifically indicated for PTSD with MDMA, and they're the first to the line with going through this process to potentially have a new psychedelic treatment for mental health indication. I mean, ketamine working in that off-label area is kind of pioneering, but it's not specifically approved.
The world of alternatives for mental health is growing fast as more states decriminalize such substances. Many therapists hope these breakthroughs will open the door for more research and nationwide practices. Well, that is all the time we have for tonight's show, but make sure to tune in next Tuesday for a recap on high school swim and dive championships. We'll see you then.